Welcome back, friends. Welcome to another session of Global Health Concern. I'm your host Shuman Bhattacharjee on behalf of Shomu's Biology. In this set of videos, we'll be talking about another health issue, that is angina pectoris. Now, angina is another very common type of health issue, though it's not that much devastating kind of system, but still angina is something you should know about because it is more common. It can happen to you anytime. I mean, during your any kind of age, any kind of days or times of your lifetime. Morely it's predominant in the older ages, but still it can happen if you're an athlete, if you are whatever profession you're in, but still it can happen. So let's talk about angina pectoris in this whole set of videos. And in this first video we'll be talking about what is angina. As like always, we always talk about what is it first. So let's begin. So angina is a it's classically it is characterized by normally the substernal squeezing chest pain. Now, so you can see here in this picture, it's clearly depicted. It's the disease of your chest. That means it's the disease of your heart. Not only actually heart, but actually the those vessels that are pumping blood, that are supplying blood to your heart. Those are called coronary arteries or coronary veins, or those vesicles. So coronary vesicles. So the problem with coronary vesicle, any kind of problem of transfer of blood into your heart can create problem. Due to lack of oxygen, or some problems, it can create immense chest pain, which occurs and begins at the heart and slightly radiating through your left arm, because heart is in position in the left side of your body. So there will be the left hand arm which is affecting the first, right? And it can occur with stress and relieved with normally rest or nitroglycerin. So simply you can take some drugs, very basic drugs, which will take away the pain, which can clear the situation. But generally angina or angina type symptoms may occur many a times of your life, but actually it can be life threatening in certain conditions, when people have atherosclerosis, or they are having any kind of arterial damage or arterial clotting that can result in stroke and many more things. Now in this case that can result in heart attack, most importantly, because the blood is supplying to the heart, right? So these are also associated with nausea, vomiting, and so on, right? So normally angina can be classified into several parts, and among them these are the basic type. But major causes of angina is the presence of any kind of blood clot, which is at the terminal part, but presence of any kind of plaque in your body, in the endothelium of your blood vessel, or sometimes finally that plaque is turned into the blood clot at the end. So these are that's in a sense in is angina. Now let's talk about the pathogenesis and etiology of angina. So if you look at the pathogenesis, it is we are having, so that whatever I've told you before, that the general cause of angina is simply due to the presence of plaque in your blood vessel wall, which is narrowing the area for your blood movement inside your blood vessel. And also finally the plaque can be ruptured and the blood clotting start to form, that can be more devastating, and it will turn into what is called the chronic type of angina. Usually it can be unstable, and then the stable one, which is the chronic one. Now actually here the symptoms are results of usually myocardial ischemia, which is due to insufficient blood flow through your uh, arteries, which are presented towards your heart, right? Or which are changed in coronary vessels, right? So any problem with those coronary vessels can lead to this type of problems. In any type of clotting or plaques present in those coronary artery can give you the problem. So you can see it is the healthy coronary artery, and coronary artery means coronary always deals with the heart of your body. So these arteries are present and they're supplying blood to your heart itself. That's called the coronary system, or the coronary blood uh, circulation system. Now coronary circulation system is the circulation of blood through the heart itself. So heart is supplying the blood through itself, because heart is also consisting of cells and tissues that they need to have constant supply of oxygen to survive. So that's why that's its own system of delivering oxygen and other things. But if there is any problem regarding that, heart functioning will be will be problematic. Heart will pump very faster to pump more blood so that it can get more oxygen due to the problem with this jam in the road simply. So that's kind of about the pathogenesis. Now it can be caused by three different scenarios. As I've told you before, it can be any type of plaque formation, which is not that much hard. Plaque formation usually can be present there with the development of age. Then sometimes it can be narrowing of artery due to plaque formation or something like that, which is getting worse by worse day by day. And finally it can turn into the blood clot due to this arterial narrowing. Now uh, everything is fine until and unless a blood can pass through. Now after a certain time, when the red blood cells are unable to pass through your coronary artery, that makes it more and more difficult for you to actually survive, because in these conditions, as the blood cannot flow, the pressure starts to build up and that artery finally ruptures, and it can cause the stroke, it can cause your heart to fail. So these things are related in these situations. Now here we depicted the scenarios of how the blood clot actually forms. As I've told you, blood clot formed at the terminal and the final stages, because at the beginning only plaques start to form. The plaque are simply nothing but fibrous caps start to form there. Now what happens here, once fibrous caps start to build there, and finally once it is building and making the artery narrow and narrower, then finally rupturation of this cap will lead to the production or release of red blood cells onto this place, and those red blood cells start to clog the artery, start to arrange the artery in so that it will block the artery. So blood flow is not possible, blood will flow back, and it will create the pressure, immense pressure in your coronary artery, and finally it will lead to the rupturation of coronary artery. So this is the dangerous scenario when once the blood start to clot. Now the mechanism of onset of this disease actually due to many different aspects. If we begin here with the increment of the heart, so increasing heart rate for any kind of emotional aspects or any kind of physical activities, sometimes after load or preload, any kind of scenarios like that, it can increase your oxygen consumption of your body. Because if you have some preload or afterload works that is tedious for you, your cells are working so hard to keep your metabolism going, so they require more and more oxygen to keep your metabolism going. So as the oxygen consumption requirement increases, it creates the chest pain, because the heart needs to pump very often, more often than it usually do. So that's why it creates a pain in your heart. And another reason for that is any kind of stenosis or thrombosis. That's the medical situation, the clinical situations of your heart, of your vessels, any kind of formation of thrombus in your arteries, any kind of plaques formation or any kind of blood clotting in your artery, and for that dosage or vasospasm can be a part of that. So all this type of scenarios can lead to decreasing of the coronary blood flow. As the coronary blood flow slowly decreases, it also can create angina. Remember, if the blood flow decreases or oxygen consumption increases, both the way it cause chest pain or angina. Now the actual scenario in all these cases, the thing to actually remember in these cases is that the problem with angina always occurs if our heart cannot cope up with the demand of the oxygen supply of your body. So it's always supply versus demand situation. So in this condition, always there are problems, whatever supply versus demand is there. If we look at the progression of the disease, we can see that at the very beginning, if this is the normal coronary artery, everything is fine, no plaques and form. Now start slowly, uh, small fatty streaks start to form, deposition of fat, deposition of cholesterol or bad fat, like those start to form, which finally creates plaque. Now during this condition, up to the formation of plaques, whatever, that isn't that much bad. Now finally, once the plaque is slowly increasing, and it starts to arrange and form with many more type of cells, like other cells, along with red blood cells, white blood cells, and platelets start to arrange, start to adhere to the inner membrane of the blood vessel. And finally the plaque and the amount of plaque and the density of plaque start to rise. And after all, once the density reaches a particular value, when it's called the obstructive value of the plaque, in that condition Finally, if we test it, we can find the test to be abnormal. Normally there are tests available to get the idea whether the disease is setting or not, like non-invasive tests. Now during the plaque, the length and density of the plaque is low or less. In those conditions, it becomes non-invasive. Those non-invasive test results found to be normal. But once the test and the plaque density start to rise, the test is showing us some abnormal effects. Now as they start to build up more and more, finally those plaques ruptures and red blood cells spill out. Once the red blood cells spill out, those red blood cells start to coagulate, and they start to jam and clog your artery. So you can see how much diameter of your artery previously is now, due to all these problems, finally the arterial diameter gets very slow, very not slow, actually very small. So these are the situations. Now there can be many different types, like unstable angina. In unstable angina, angina. In unstable angina, what happens that that blood flow is blocked by any kind of thrombus or movement of clog or clot, or some plaque that can be removed easily. But acute kind of situation or chronic angina is also possible. That's called acute myocardial infarction. So in that kind of situation, these clots start to be very prominent and permanent in in those places of coronary artery, and that creates more and more problematic situations for the people who are having angina in those situations. Okay, guys, welcome back to another session of Global Health Concern. I'm your host Shuman Bhattacharjee on behalf of Shomu's Biology. We are talking about the types of angina. Actually, we are talking about what is angina, and the different properties of angina and all these things. Now, in this video, we'll be talking about types of angina. So types of angina you need to learn a little bit, because there are several varieties of angina. Some of them are really harmless, because not actually harmless, but it usually occurs many a times of our life. If you're growing older, you probably have angina at your time, or some like that. But certain types of angina are more dangerous, so we need to know which are of more concern and which are of not. They can be actually divided into three parts, like unstable angina, which are simply small versions of angina, and that is caused due to the blockage of coronary artery. Now I remind you, all the form of angina is simply blockage of coronary artery, and blocking of the blood flow of coronary artery. And for the unstable one, the blockage is done by simple plaque formation or movement of thrombus. On the other hand, there is another one called chronic or stable angina. That is also due to the fixed stenosis, that is completely fixed, and blood clots start to arrange. As blood is clotted, the movement of blood is not possible through that coronary artery, and sometimes pressure start to rise, blood pressure start to build up in your heart, and eventually that artery ruptures, and in this case that demands ischemia. And finally, another one is there, that's called the Prismental's variant angina. That's also caused due to vasospasm. Vasospasm is the spasticity of your vessels of your body, that is, it becomes very spastic, very tightened. As a result of that, the fibrous nature becomes more and elasticity goes down. As a result of that, it can also cause the effect of angina. So first of all, you can see the stable one. Now what we know about the stable one, it is provoked by physical exertion, or especially in the cold weather, after meals, or commonly aggravated or higher, or any kind of excitement. Usually stable kind of situation occurs because of huge emotional impact is also related. Now the pain fades quickly with the normally with the rest, and in some patients pain occurs a level of exertion at a particular time. Now, unstable angina is caused by unstable plaques or occurs at rest, which is unpredictable. Pain can increase for no obvious reason for this case, because unstable angina can occur any place of your body. Actually, mostly in the coronary arteries, but any places in the coronary arteries. Even if you remove it, again it can form. You can't even know when it's going to form, and it can give you too much of pain and trouble. And third is the Prinzmental's angina, which occurs without provocation, usually at the rest, as a rest of the coronary artery spasm. Mostly they're caused by the coronary artery spasm, and that is a type of problem that you need to be very much concerned, because this is not unpredictable or general. You have some problems with your elasticity of your blood vessels, so you need to consult with your doctor pretty fast to check what is going on there, right? So this is a stable angina pectoris that we have already talked before, that is provoked by physical exertion in cold weather, right after the food and excitement any kind. We have already talked before, and usually it is nothing but the insufficient blood flow to the heart muscle, narrowing of our coronary artery. That's what stable angina pectoris is all about. And in the future, all the videos that we'll be talking about the angina pectoris, we are morely concerned about talking about this stable angina pectoris, not the unstable, because they are unpredictable. We can't actually predict things. We can't actually take that as a granted thing. But stable angina can be researched, and we will be talking about stable angina pectoris and more about stable angina pectoris in the future videos. Now, if you want to classify stable angina pectoris, it can also be classified into several different parts. Now, first of all is exertional. Now, exertional is the coronary artery obstruction and that are not sufficient to result in resting myocardial ischemia. Now, however, when myocardial demand increases, ischemia results. It's not always means ischemia will set, but myocardial oxygen demand, when it increases, it can create the problem. Now, second thing is the variant angina. Now, in this case, it is again transient impairment of coronary blood supply and by vasospasm or the platelet aggregation in the inner membrane or inner wall of our coronary arteries. Now, majority of the patients have an normally in this case have the plaque that is formed atherosclerotic plaque, that's also called atherosclerosis, as a diseased condition due to the high cholesterol presence in their body and bad fat present in their body most of the time. Now, generalized, so in this case, it is normally generalized arterial hypersensitivity can also result due to this clogging of the blood type, which is the type I exactly not uh, recall nowadays, but a type of hypersensitivity usually is related with this, and a long-term prognosis is very good for this type of scenarios. Now, third kind is angular equivalent syndrome. Now, in this case, patients with normally exertional dyspnea rather than exertional chest pain actually witnessed. Now, in this case, it is caused due to exercise introduced by left ventricular dysfunction. Normally, left ventricle dysfunction is the major cause of anginal equivalent syndrome. This is not exactly angina, that's why it's termed as anginal equivalent syndrome, but it is related with that, and all the symptoms are like angina type of symptoms. And people always have more dyspnea like condition than the exertion chest pain. Prinzmental, we have already talked before that it is due to completely due to spasm, right? And it's not actually very common in people, but it's present there, and it's also transmural ischemia is the typical characteristic of this type of situation. And the elevation of the chest pain occurs with exercise. So that's why I've told you that if you're athlete and whatever, angina won't leave you. Syndrome X is another thing, which is normally a typical exertional angina with positive exercise stress test, and also it is anatomically normal coronary arteries always we can find that normal coronary arteries are found, but still there are some problem, and the problem originates certainly, and it causes some of the effects. Now, it reduces the capacity of vasodilatation and microvasculature, right? So normally reduces the capacity of vasodilatation, and as a result of the capacity of vasodilatation removes, and still if you're having any kind of hypersensitivity conditions, it creates a horrible problem in those situations, because your blood vessels try to be vasodilated, but it cannot, so it creates a kind of very uh, mutiny like situation in your own body. And in this case also long term prognosis is a good choice. And silent ischemia, that's another thing here. Silent ischemia is very common. It is difficult to diagnose, and usually Holter monitor is used to diagnose that. Exercise testing is used, and more episodes of silent than painful ischemia in the same patient can be found repeatedly. And in this case it is a form of ischemia, but silent means you can't actually predict anything, you don't know what is going on. Silently you have some chest pain and some arm pain radiating in arms and all these things, misfunction of your blood, of your heart pumping with the blood and all these things. So these are all about the classification of angina, and I hope that's helpful. Thank you. Welcome back, guys. Welcome to another session of Global Health Concern. I'm your host Shuman Bhattacharjee. On behalf of Shomu's Biology, we are talking about Angina Pectoris. We have already talked about what is Angina Pectoris and what are the different properties of Angina Pectoris, how this disease actually occurred. Now we know that angina is a heart problem. It is problem with your coronary circulation system due to any kind of blood plaque or any kind of blood clotting in your coronary artery. It reduces the supply of oxygenated blood into your heart. As a result, heart has immense chest pain. Now in this video we'll be talking about the symptoms of angina pectoris. Okay, so let's begin. Now, the clinical symptoms of angina pectoris can be divided into several parts. For example, patient's history is one of the most important symptoms people usually look for. It's always a golden standard, people always say, because history and the clinical history sounds to be most important for any doctor, any medical expert all the time, because it is telling some important insight about the disease to the person. Second thing is the retrosternal pain, because you know retrosternal pain is actually associated. This is the retrosternal pain that is the typical character of angina, so you need to look for that. Dyspnea is another important thing. Ishchemia is another important thing. Is that nausea and vomiting are associated if you're having angina in most of the situation. Arrhythmia is another situation. Restlessness will be associated, because imagine if your heart receives less blood, your heart will pump more. You have immense chest pain, which is related with dyspnea, retrosternal pain, and all this thing. Pains radiating from your heart throughout your left hand and all these regions. Restlessness will occur because your muscles are receiving less oxygen due to the low blood flow, and that's why it's called restlessness. And any kind of divine sign are the symptoms for that purpose. And and usually these symptoms and some of the symptoms like chest pain and dyspnea may be associated with some other major diseases and infections also of your body. But if some of those pains are eased after taking nitrates or after taking calcium channel inhibitors, you should be sure, you can be confirmed that whatever is you're having is a type of angina. Now, what are the risk factors that we're talking about with angina? You know, there are certain risk factors we always need to take care of using angina, because in angina there is a problem of the vessel constriction due to vessel contract not contraction actually blockage due to any kind of plaque formation or blood clotting or something like that. So if you're having a cholesterol high percentage of cholesterol present in your body, that can cause some problem. And if you are having certain other diseases or genetic disorders, malfunctions of your body, that can also cause problems. Atherosclerosis can make your situation worse. So there are certain risk factors like hypertension, because suppose you are having that blockage of into your coronary artery and blood flow is not firm, so it creates huge pressure of blood in your artery. So still if you're having hypertension throughout the time, it can create more pressure and coronary artery ultimately ruptures. It can cause a heart attack instantly. Second thing is obesity, which is also risk factor. Obesity is risk factor for all many major diseases, because if you are having obese, you are having more cholesterol in your blood. If you are having more amount of fat, unsaturated fat, actually saturated fat in your blood, which are bad. So for that, those bad fats can create certain problems. The receptors can be problematic, so that can create these situations more worse. Hyperglycemia is another thing, so you need to check constantly if you're having angina or any kind of angina symptoms in throughout your history. You should check for the glucose level of your blood throughout the time, because more glucose level can create some problem. Hyperlipidemia is another problem, because if you're having more lipids present in your blood, that can also create problem that I've told you, because it can create more contraction actually. Then asculation is another risk factor for all these things. Welcome back, guys, with another session of Global Health Concern. I'm your host, Shuman Bhattacharjee. On behalf of Shomu's Biology, we are talking about angina, which is a heart disorder or disorder of coronary artery due to the attachment of some plaques or blood clogging. It reduces the blood flow and it sometimes creates the rupturation of blood, and it can cause your heart attack in many aspects in the terminal region. So So that's why we need to diagnose this disease very well, because it can be classified into various types. They are having various implications. So we need to understand what is the diagnosis of angina. So diagnosis is obviously always an integral part. So for diagnosing angina, we need to look for symptoms. That's the first important thing for looking the clinical history of the patient, because still doctors believe that's a golden standard for diagnosis. Except for the laboratory tests like leukocyte, the total blood count, total blood of leukocyte, total blood of erythrocytes, hemoglobin count, thyroid hormones that are present in your body, cholesterol that is present in your body, troponin, INT, and MBCPK. All of this, the presence and amount should be normal. So you need to check whether these things are normal or not. Second thing you need to look for is ECG. If there is any problem with your heart, it should be reflected in the electrocardiograph of your heart, because that's going to tell us how your heart is functioning. So problem with ECG can give you some trouble. Exercise ECG as well as resting ECG, both of them are required, because sometimes resting ECG is not going to tell us any difference between the normal heart function and the heart function with angina. So we need to believe with exercise ECG, because angina or type of angina symptoms are getting worse and more after the exercise. So if there is any change, we should depict it in the exercise ECG. Cardiac scintigraphy is another important thing that can be performed. This is also type of a graphical representation of the functionality of your heart and how the oxygen uptake and the blood pumping in and out through your blood. uh, Echocardiography or echocardiography, whatever it is, also part. Coronary angiography is another thing, which is simply coronary angiography is always dealing with uh, the 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 problem and the functioning of your coronary blood circulation system with your coronary arteries and all of them. You should get a result in coronary angiography if you're having any angina like problems. Welcome again, guys. We have talked about many varieties of angina in global health concern. Again, this is another session with your host Shuman Bhattacharji on behalf of Shomu's Biology. In this video, we are going to talk about the treatments of angina. Now, angina is a typical type of disorder because there are some typical medications for angina that can be used to treat it. Medications or drugs, then post-medication care, some other factors, except for clinical use or clinical medication we can use. And let's begin. We can look for three major types. Actually, you can use medicine, we can use paracutaneous intervention, or another total different type which is called CABG. So very first we'll be talking about the medicine and considerations. Obviously we need to talk about when we take medicines, because they're chemical agents, they're doing certain things. So we need to always think whatever type of medicine we're taking, certain important factors like the effect of that medicine in myocardium, because if there is problem with the interference with the myocardium, which is the muscle of our heart, which is the core of our heart, where the heart is functioning, for the functioning of the heart, for the beating of the heart, for the pumping of blood through the heart. If there is any problem, or if that medication is hurting the myocardium and the functioning of heart pumping, we should not take that medication. Second thing, we need to look for the effect on cardiac conduction system. That's also important, so that we can get a sufficient simple rhythm of our heart. The effect on coronary arteries, because the disease is itself in the coronary arteries. The disease is the blockage of the coronary arteries. So we need to take a medication which will lead to no further adverse effects on the coronary arteries, because coronary arteries are already getting some adverse effects. Effect on venous capitans system, effect on normally circadian rhythm. So if that medication is changing our rhythm, our circadian rhythm means how our body clock actually organizes us with the different timing or work shifts of our body. So interference with any of these things should not be tolerable. It is tolerable up to a certain mark, but not more than that. So once we consider all these important parameters, we can use certain chemicals, we can use cite certain medications for the treatment, and there are some prescribed common medications that people use to treat angina symptoms. For example, beta blockers. Now, in this case of beta blockers, they actually decrease the myocardial oxygen consumption. As they decrease the myocardial oxygen consumption, we don't need to bother about supplying more blood, because they cut the oxygen consumption. As a result, we don't need to be the heart don't need to be more aggressive for pumping the blood, so they can relax at a certain extent. Second thing is it also help in the blunt exercise response. And beta 1 drugs have normally theoretical advantage, but it's not actually that much tested practically how it is actually having and all these things. And usually it is the first line of therapy in all patients with angina, if applicable, if this drug is not creating any other side effects. Second thing are calcium channel blockers. Now calcium channel blockers are actually having the more function of arterial dilation. So normally that's the major function of calcium channel blockers. uh, so it is after a load reduction completely, once the load is start to form in your coronary artery, plaques start to form, this calcium channel blocker can block that calcium channel that is present in your endothelial cells and all these things. As a result, arterial dilation is possible, and coronary arterial vasodilatation is mediated, and it prevents the coronary vasoconstriction. As a result, it will prevent that huge pressure that is building upon your coronary artery. So it actually helps in certain extents with your rupturation of coronary artery or heart attack in that time. and uh, and it also slow the heart rate in certain extent. So that's why they are really important in all these aspects. And the most important and most common one is the nitrates. It's found to be very effective against these situations, because nitric oxide has been identified as the endothelium derived relaxing factor. So they relax the endothelium of your of those vessels, blood vessels or coronary arteries. Now organic nitrites or nitrates are therapeutic precursor for endothelium derived relaxing factors. We can so also use organic nitrates in these places. Then we are having aspirin. Aspirin is a typical pain reliever. It can help you to relieve the chest pain which is radiating. You can use in dyspnea and all this stuff. Statins can be used. Angiostatin is a type of statin that is directly used, which is also helpful to maintain your elasticity of your coronary arteries and help to reduce that pain and little extent. So that's kind of it once we talk about the medications, and these are the references that I usually use. Very thankful to all of them who are getting this actual content, and I'm just sharing material, so actual copyright goes to all the content developers there. So that's it. Thank you.